as promised, we're doing a live demo on our YouTube channel as well as Periscope. Can you see me pretty well there? Okay, so, and this is in the background. I think I'm going to move it a little bit so I can get right to where we're injecting. But today's demo is on how to remove those eyelid bags. I know there's a lot of people who are interested in this. This is why we have this topic today. And I'm going to do a little demonstration today to show you how those eye bags can go away, as well as any hollowing. So not just eye bags, because some people don't have bags, but they have a lot of hollowing under their eyes that make them look tired. I think the biggest takeaway from this is, how do I look well rested and not tired all the time? Well, the filler that I like to use for this particular area is Restylane. I do use some Belotero sometimes if there's a little bit of hollowing, but for the majority of my patients I use Restylane, and it's a very easy procedure to do, very little downtime, can come right in the office. There's very little bruising. I usually use, instead of needles, I move towards using cannulas. And what are cannulas? Cannulas are a blunt tool instead of using a needle. Instead, it's a hollow core that has at the end a little spot for the filler to be injected and comes out of the hole, instead of using a sharp needle. So sharp needles, of course, you would think anything sharp can cause bruising, can cause bleeding. And so we're trying to avoid the bruising. We want to look well rested without any downtime. So before I go on, if there are any questions people want to put out there, are you seeing any questions? Any posts? Take a look there. Sometimes people will put posts and no? Okay. Well, so our model here today, she has a little bit of hollowing underneath the eyes. You can come closer. Now the video, if we could bring this closer too, so I could show what I'm trying to demonstrate. Can you see? You've got to come closer too. And there, this other camera's not in the way. Can you see everything? Okay. So the hollowing that we're noticing on her is that she's got this area underneath the eyes. And most of you will say, well, that's not too bad, right? How old are you?
35.
35. Okay. So the hollowing starts to show up in people at different ages, I would say in their 30s to 40s, and then it starts to accelerate after that. So what I'm going to do is I'm going to make a little hole here lower in the cheeks, and then insert this cannula, which I'm going to show you, and we're going to inject around the eye. The filler that I'm going to use, as I said, is Restylane. It is a, I'm going to wash my hands here while I'm talking, so I'm just using this to gel right now. The filler that we're using is a hyaluronic acid filler. It is reversible if there's any concerns about how the product looks. Some of the concerns that people might have is, can the product lump and cause bumps? Yes, it can. Any filler can, so it doesn't matter which type of filler we use. It's really about the person injecting and making sure that the injection is done deep and right on the bone. I'll head back. I don't know if you could see the difference between the two sides. I think one thing I want to just show so that people could see. Let me have you sit forward again one more time. You can see the difference between the two eyes here versus the hollowing here and the hollowing in here. So we've filled in both sides. Can you see as well? Because you see. Yeah?
Yeah.
Yeah, okay. All right, we're going to move over to the other side. Sometimes it's hard to find that hole that I did originally make.
All right.
A little bit more. Sometimes I need to use the needle again to make a little poke. Sorry about that, Ed. That hurt tough. You've got nice, tough skin.
I know.
Okay, there we go. Open your eyes. Look up at the ceiling. Okay. When she looks up the ceiling, I can see exactly where she's hollow. and where we need to add a little bit of this filler. Okay, you are actually a little more hollow on the other side than this side. But yeah, boy. Thicker skin.
Yeah. Must be that Asian skin.
Asian skin. It's good. Makes it hard for me though. I know. This is why we usually have the vibrator here. This spot is the spot where I have to do some finagling. Okay. I don't know if you can see as the injection's being done. Probably see that. Okay. Okay, and we are done. I know. Okay.
I can't wait to see.
We'll let you see. Just a little oozy at each spot where we injected it. Okay. I'm going to have you lean forward a little bit too while we do this.
You want me to?
Nope. Got it. We're going to probably put some ice on this one spot. Okay. I think you need a little bit more, so I'm going to actually open another one. But usually one syringe is enough. In her case, she's got good volume in her cheeks. That hollowing looks more apparent on you. Yeah. I want to switch this out. Okay. I'm going to have you ice for me. Get that out. Let's see. Okay. All right. So, I wanted to point out, so now you can see, once we move this away for a moment, okay, it's just a ooze, a slight ooze. You could see that the area that we filled in right here is now filled in, okay, the area of hollowing. And we'll do a before and after photo so you could see how that appears. And the area of hollowing that she had out here too has now been filled. I think we could add just a little bit more on that side and it would be perfect. Can you see, Anne? You see the difference?
Yeah.
That we've created?
Huge difference.
Okay. So that tired appearance is now gone. Okay? Within a couple minutes, we're able to do that with just a little bit of filler and the only downtime will be, most people just have those tiny pokes where the poke was made, but other than that, there's no other needle marks, and there's no bruising. No bruising here, right? No bruising. Okay.